How do tattoos heal in your skin? Good question. I'm glad you asked. Well, it all begins with the immune system, and specifically, it's going to be these two cells up here, the monocyte and macrophage. The tattoo needle is going to pierce the skin at the epidermal dermal junction, which is where the monocyte and macrophage immune cells are going to live, circulating the blood vessels and the lymphatic cells, letting the body know if an invader has come into contact. Now, the tattoo ink that we use should be non-toxic, meaning it's not harmful to us, but our macrophage and monocyte cells don't know that. All they know is that an invader has entered the skin, and so it's going to go around, it's going to find all those little ink particles, and it's going to gobble them up, trapping them inside the cell. Once those particles are inside the cell wall, the body is going to be alerted whether or not it's particles that are going to cause infection, going to cause harm. But once they're in there, the ink particles are usually too large to then get spit back out and cleaned up by the macrophage and monocyte cells and leave the body's immune system and get cleaned up the way a dirt particle would. And that is how tattoos stay trapped within our skin cells, exactly where the ink was placed, and it doesn't get moved or shifted around during the healing process. The first 3 days of the healing process are going to be the inflammatory stage, where the body is going to be releasing serum. It's again trying to clean up those ink particles, trying to push everything bad out of the skin cell that it doesn't recognize. But those ink particles should be trapped exactly where the tattoo artist placed them. And what the body is releasing is going to be serum, white blood cells. It's trying to clean up the skin surface and bring all those human growth hormones and healing factors to the skin to prevent infections. So you're going to see some weeping, you're going to see some oozing, and you're definitely going to want to keep it covered when you're sleeping, unless you want to get stuck to your sheets in the middle of the night. After 3 days to a week of skin healing, your body is going to get very dry where the area of the tattoo was, where the area of the skin damage was from the needle rubbing all over the skin, implanting ink. And your body is going to peel off that top layer of skin, much like a sunburn, because it doesn't want to replicate that damaged skin. It wants to create new skin cell layers from deep within. And so you're going to notice a lot of drying, a lot of peeling, and you're going to want to keep that area moisturized and hydrated, because if you pick at this skin, yes, the macrophages and the monocytes have trapped the ink within the tattoo, but if you begin picking at this flaking skin and pulling it off before it's sealed into the deepest layers of the skin cells, you're going to notice fading, you're going to notice uneven coverage of the ink that's tattooed in the skin, because again, you've pulled it out and pulled those macrophages and monocytes that were healing in the skin out before they could heal into the skin and seal that tattoo for years to come. I wouldn't necessarily recommend using this much moisturizer, but you want to keep the skin hydrated during the healing process and for years to come, because it's going to keep your results looking more vibrant. Because again, even though the technique may have been perfect, that skin is now damaged skin, and you want to make sure that it's got the nutrition and the hydration that it needs to not only keep the ink looking vibrant for years to come, but to help that damaged tissue heal in the early period so that it doesn't create any scarring that may affect the long-term appearance of the tattoo. So that is how a tattoo heals in the skin. Remember, it's all about the immune system. So if your tattoo wasn't implanted deep enough into the skin, it may not be there because it didn't signal the immune system that there was anything to catch and trap. And if you have a really raised or bumpy appearing tattoo, it may be that it actually was implanted too deep in the skin and dug up some collagen and really created some trauma. So understanding the importance of good tattoo technique and how it's going to affect the healed result is super important. So there you have it. That's how tattoos heal in the skin. I'm Nurse Tracy. I've been a registered nurse since 2008 and a cosmetic tattoo artist since 2019. So if you like this, stay tuned for more videos.